Hey folks, it's Dr. Sam, and I want to talk to you today about retinal detachment. The retina is the part of the internal lining of the back of the eye. It contains a lot of photoreceptors which capture the light and they send an electrical impulse through the optic nerve back to the brain, and that's how we see. There are three main types of retinal detachments. The first is when the retina actually pulls away from the back of the eye, and this is due to fluid that collects behind the retina. The second type is called traction retinal detachment, and this is when a part of the retina is actually pulled away, and it could be because of just a general aging process or a dehydration in the retinal cells. And then the third type is where the fluid actually builds up behind the eye, but it collects in pockets. So it doesn't collect all through the retina, but there's definitely fluid damage. And this is mostly caused by an inflammatory response or an inflammatory eye disease. Now, in terms of symptoms of retinal detachment, you get conditions like cobwebs or flashes of light. Sometimes there's a curtain that will drop down in front of your vision. So this is a very serious medical emergency, and you want to go to your eye doctor immediately if you've got these symptoms. So in terms of some of the causative factors, it usually happens in men over the age of 40, usually Caucasian men. If you are extremely nearsighted, you're more susceptible to retinal detachment. If you've had eye injury or trauma, this is another reason why you could develop a retinal detachment. And if you've had it in one eye, you could get it in the other eye. Obviously, stress, trauma, and toxicity can be contributing factors to retinal detachment. I would also take a look at the pharmaceutical drugs that you're taking. So if you've been taking long-term steroid drops or steroid drugs in general, this definitely weakens your connective tissue, especially in the eye. There was also a study that was published in the Journal of the American Medical Association, which linked oral antibiotics to having a higher risk of retinal detachment. The main type of surgery is a laser surgery where they actually freeze part of the retina so that they limit the damage. If it's a more serious retinal detachment, they will do something called a scleral buckle, where they can do a vitrectomy and they actually take the vitreous gel out of the eye and they replace it with a gas. And this actually starts to push the retina up against the internal lining of the eyeball to help reconnect the retina to the eyeball. So obviously, this is a very serious condition, and some things that you can do to avoid retinal detachments would be things like reduce or eliminate gluten in your diet, because gluten is a major inflammatory response to the brain and the eyes. So gluten, dairy, sugar, you should definitely cut those out. You want to reduce any inflammatory response in the body, so I would increase your probiotics and pre-probiotic fiber. I would get at least 30 minutes of exercise every day, and I would really pay attention to the stress that you carry in your eyes. This is very common with digital device users. You want to make sure you're not wearing a prescription that's too strong for you. And if you're wearing a prescription for distance and you're using that for the computer, then that's going to create stress in your eyes, and you want to get a reduced prescription that would be just for the computer. I would also move away from things like progressive glasses, progressive lenses, or bifocals, and get a single vision lens so that the bigger the window you look through, the less visual stress you have when you're doing your near point focusing. I would also be aware that if you've had cataract surgery or LASIK surgery, you do have a higher risk of developing retinal detachments. So you want to talk to your doctor about the risk factors. And of course, finally, the retina needs very concentrated nutrients, things like lutein, zeaxanthin, astaxanthin, vitamin C, vitamin E, omega-3 fish oil, beta-carotene, quercetin, bilberry, taurine. So make sure you're getting a really great eye vitamin. I would also include glutathione in this, because the more eye nutrients that you're taking, the more you nourish your eye tissue, especially the retina. So that's my message for today. I want to thank you so much for tuning in, and until next time.